Hello and welcome to Fit to Speak. I'm Eugene Oba. So glad to have you with us. As all stars and movie stars run from Georgia like the plague and March Madness is long over, the world is still waiting for the novel coronavirus pandemic to fall out. With all Americans 16 years and over now eligible for getting the COVID vaccine, we continue our conversation about it, the inequalities in health outcomes among minorities, as well as the Tuskegee experiment and the impacts on vaccine hesitancy with pharmacist Safiya Ransome. That and more coming up later in the show. But first, nearly 1 year after the death of George Floyd, former police officer Derek Chauvin, whose knee was on Floyd's neck for nearly 10 minutes, was found guilty of all charges against him by a jury of his peers. The reaction, palpable. Chauvin is scheduled to be sentenced June 25th, over a week later than initially scheduled, and we'll be talking more about the implications of these developments in future editions of this program. It's now been 100 days since U.S. President Joe Biden occupied 1600 Pennsylvania Avenue. And while many, I'm sure, will comment on some of the good and, well, not so good aspects of Biden's presidency thus far, I want to take a bit of a trip down memory lane to day 64, in which the president had his first presser. More specifically, I want to focus on one of the reactions, this tweet from former White House Press Secretary Kayleigh McEnany, who, might I remind you, is the same Kayleigh McEnany who thought that Paw Patrol was a victim of cancel culture when it's actually still on the air. Oh, and there's going to be a Paw Patrol movie released August 20th. Anyway, the fact that the vaccine has been rolling out as it's been over the past few months has had zero to do with Operation Warp Speed, as Kayleigh claims, though there was a pause in the rollout of the Johnson & Johnson vaccine earlier in April after 6 people developed blood clots out of nearly 7 million Americans who received the vaccine. Despite the development of additional cases of blood clots, bringing the number of people to 15 with 3 deaths, the pause has since been lifted, but with added warnings. I'd advise Kayleigh to go to our YouTube channel and watch this portion of the March 25th edition of this program.
With the previous administration, there was a news story that came, I think it was in January, that there were, batches of vaccine that were just unaccounted for. They didn't know where it ended up in the system, if it went to the right place or is sitting in a warehouse somewhere. When Biden came in, they said that they really had nothing to work with.
And remember that by the end of last year, only 2 million people got vaccinated, a far cry from the 20 million people promised. If that's considered warp speed, then this Diamondback Terrapin must be a Lamborghini. And speaking of terrapins, over the past few weeks, the University of Maryland have been rolling out the vaccine to students, faculty, and staff. This, as the University System of Maryland, of which the University of Maryland is the flagship university of that system, have now mandated that all students, faculty, and staff be vaccinated. This is also on the heels of other universities across the country, including here in the Baltimore-Washington region, that have recently enacted similar mandates. While Kayleigh, I'm sure, will not be heading back to, say, Georgetown or Harvard Law anytime soon, I might recommend kindergarten as a suitable place for her to learn the difference between Feats and Feet. I mean, for somebody who's a member of a party that was gung-ho about making English the official language of the United States, she's not exactly in the position to be making it. Well, the attention that she was getting for all the wrong reasons was too much for her about 4 hours later when, while lying yet again, she writes in part, quote, "Bravo to the blue checks. The irony apparently lost on Kayleigh." Now, here's some breaking news that you may have missed on April 15th. Mike Pence is now the president. That is, if you believe this tweet from Politico. Now, in fairness, this was a scheduled tweet, but somebody had to type that in there in the first place. And remarkably, the tweet is still up. This is reason 1,527,678 why we should not eliminate copy editors from publications. We shouldn't. Now, here's something a little lighter.
I have some exciting news. Is everybody ready? Okay. So Women's Wear Daily just announced a brand new lifestyle magazine that will hit shelves on June 14th. And guess what it's called. It's called Drew! Yep, that's it. It's just Drew.
I find it quite remarkable that movie star turned daytime talk show host Drew Barrymore is launching a magazine, especially given the headwinds that print journalism has faced in the past few decades, including the O magazine, which moved entirely online after 20 years. Drew's magazine, which will include an eclectic mix of items, including Drew's News, a signature segment on her talk show, will be released quarterly, and perhaps I'll have a review of it in a future edition of this program. Drew Barrymore has brought an incredible level of authenticity, absolutely incredible authenticity to the daytime genre, as evidenced by the fact that her talk show has been renewed for a second season. People know really what's real and what isn't, especially as Ellen DeGeneres has found out. Drew's energy is truly infectious, and hopefully she's going to bring a lot of energy to magazine journalism. And if she is to be successful with this, as I hope she does, if she is to be successful with this, then this could create a mini renaissance for magazine journalism, for print journalism. And hey, this is going to create more opportunities for fellow journalists. So I say, go get them, Drew. I hope that you will serve the news sunny side up. And hopefully the magazine will be better than Fox News's attempt at a comedy show, a show that I hope will lead to the gates of hell. Maybe I do have a future in comedy writing.
From the top, obviously there's a history of medical racism in this country. And Black people have every right to be weary of medical procedures or things like that that may or may not have our safety in mind. Now, the fear surrounding the Tuskegee experiment is justified, but I think one of the most important things for the people to remember about that is that that was an experiment not treating Black people. They allowed Black people to have a treatable disease and just watch us die, essentially, or develop complications. Now, what we're dealing with right now is actually like an inverse. So we have a treatment, we have the ability to get it to people, and we want to get it to people. So for people to be like, I don't want it because of the history of Tuskegee, is kind of backwards, because it's like, no, we want you to take this. The history of Tuskegee is that they threw Black people to the side and treated us as less than human and as an experiment to just watch us wither away. So while the fear is grounded in reality, it's not a one-to-one type of situation. I think right now there's a fine line to walk. While we have to remain aware of and vigilant about the harm that can come to us from a system that was not built by us or for us, we run the risk of almost excluding ourselves from something we need if we are already approaching it with, well, that can't be safe for Black people. That can't be for Black people. Because what history shows is that they experiment on us first. They, give us things first and watch us suffer or otherwise before giving it to the public. The public is getting it. White people are getting it. Other people of color are getting it. So right now, the way this looks is it's not a slight or an attempt to put something into Black people that will make their lives worse. So I don't want people to approach it in that way. What has made our situation worse in regards to COVID-19 is that Black people have been ignored. That's why the death toll has been so bad for us, because we live in places where there are fewer medical facilities, or we work in jobs where there's less access to adequate care, or we work in jobs where you have to show up every day and be in front of people, be in the grocery store, be in the Target, be in, whatever frontline work it is that you do, and at the same time not have access to the care that you need. So the situation that Black people are in economically and socially has exposed us more to COVID than that of other groups. And you know, that's like the line that we need to be aware of. It's not because, you know, they want to give us this weird vaccine that's going to harm us. It's the situation we're in is bad because of the history of the system of this country. And I feel like the vaccine is finally the one medical equalizer that we have. And now the goal is to get it to people. And, you know, it does come down to like talking to your family, talking to your friends, and giving people the resources they need. But I'm really afraid of us as a group of people using that history to like cut ourselves off from something that is going to save us.
I like the fact that you touched on the fact that, you know, the jobs and everything else that those, especially in our community, are working. And even the other thing that I was just thinking of right now was the fact that, again, the access to these care centers, even something as relatively simple as, say, the grocery stores, you know, and all of that, because there are some places that are food deserts. And we want to talk about people eating healthy, you know, exercising and that sort of thing. But if they don't have access to healthy food and all that, and all there is on the street corners in some of these areas are like McDonald's and Burger King and that sort of thing, then it's kind of like, what do we expect?
Right.
You know, it's a double-edged sword.
Right.
Go ahead.
It's really like so many of the injustices visited upon us are culminating in this moment. You know, whether it's like you mentioned just now, food deserts. For example, down in the South, Publix is going to be disseminating vaccinations. There are some communities that are 20 miles from a Publix. Black communities don't have one in their neighborhood. So, you know, all of the history, whether it's, you know, redlining and economic, you know, exclusion and things like that, like all of that's baked into our system right at this moment and has manifested itself in, you know, health disparities, like the fact that we have more hypertension, more diabetes, things like that, which make people more, you know, likely to pass away or have serious complications from COVID, which also potentiates their likelihood to, you know, have access to the vaccine if they are, you know, homebound or they're far from a grocery store that will be giving the vaccine. So there are so many things, you know, that have already made this as complicated as possible. And I really feel like the best way to root those, you know, to equalize things is to understand that and make, you know, specific interventions that address that.
There has to be a lot of flexibility here as we move forward and, you know, hopefully to a post-pandemic society. And
hopefully,
hopefully, whenever that comes, you know, I've been telling a few friends of mine, wouldn't surprise me, given the behavior of some people, that it may be 2025 or 2030 at the rate that we're going.
Right.
Especially some of the more selfish folks, you know, that are out there, you know, kind of. I'm just reminded of those in Michigan in the early stages of the pandemic last year, being at the State House, screaming at the top of their lungs, going to the mall to go to the mall and all of that, which is absolutely ridiculous.
Which was insane. It was crazy. You know, that's also the other part we're dealing with, like I mentioned before, the information environment that we live in. There are going to be people who are just resistant to the truth. And resistant to taking the measures we need to. Now, I put a lot of the blame still on the government because, you know, if the government says, you know, that like early on, no non-essential businesses are going to be open, then nobody's going to go outside. But if you start to insist that restaurants can be open and we can seat 50% of the people in there as if aerosolized virus cares about how many people are seated in a room, but you know, we keep giving this leeway to do a little bit more, to do a little bit more. You can go here, you can do this. And while there's a certain degree of personal responsibility, there's also a degree of societal responsibility as well that is not living up to what it should be. So it's really a confluence of so many factors. And the vaccine, I think, is, half of the answer to the problem. Getting people vaccinated is going to take time. It's the best thing to do. But there are other countries in this world that don't have a vaccine and have kept it together, right? I was reading about Australia, actually. First world country, big cities, they've had 30,000 cases of COVID, 30,000 period, and 900 deaths. Now, no death is good, obviously, no level of death is good, but 900 versus the over 450,000 people that have died in the United States is a significant difference. So, there's a point where we also have to look towards our leadership and say, hey, you're going to have to bite the bitter pill. And maybe we do need to lock down a bit again. Maybe we need to make sure that people don't go outside for a while, or at least do it in isolation as best we can. Because the vaccine alone, it's still not guaranteed that it prevents transmission. It just prevents you from developing the disease.
Correct. And it's like, I just look at, like, say, the Pfizer vaccine, the Moderna vaccine, they're on 95% efficacy when I look at some of these numbers. And, I tell people, it's like, yes, okay, it may reduce your chances, but then still people have to wear the mask. People have to still do the social distancing and everything else.
Yes.
And, I'm glad that you really picked up on a great stuff about the government and in terms of its leadership, or, lack thereof. I'm just reminded just now that, Ron DeSantis, the governor of Florida, and then Senator Marco Rubio, they wrote a letter saying that they don't want to have any sorts of interstate ban on interstate travel. We know that Florida hasn't really done a good job in terms of managing this pandemic. Quite candidly, I'll just come right out and say it. I think that's not exactly a shining example over there. Right. And let's I'm really enjoying this. Let's jump on this talk about the government before I get to the last question here. You have said, Safiya, that the leadership, it's all about leadership among our elected officials. One of the things I've even said on this program is that really there was no plan from the previous administration regarding the handling of this pandemic. But you had, the previous president saying that it's a hoax, not taking this seriously, not wearing masks, and then, he got COVID. And still that did not do much to, humble him, in any sort of way. And then, as we touched on earlier, you have all these people who have, especially in the early stages, going, protesting with no masks, screaming at the top of their lungs to go to the mall, go to the nail salons, and all. And what I find interesting about the way that these restrictions have been is that we locked down when the numbers were a lot less. Now there are a higher numbers, and we still have people who are, they were like, okay, we can have the restaurant open, we can have the mall open, we can have all this stuff. And it's, for me, it's just weird because it's like we locked down with a lot less.
Yes.
Can you? Yeah.
It's completely backwards. Yeah. I wish there were, an observation that I made, I had a conversation with my mom early on that there was a brief period of time in this March of last year, at the very start of this, where there was almost a somewhat unified response that this was serious. We needed to take it seriously. We're going to close schools. We're going to shut down non-essential business. We're going to do what's right in order to take care of this problem. And it wasn't until our leader at that time decided to throw it away. It was his decision and the decision of others of his ilk and around him that decided to throw that brief sense of unity away. And then they made the public health initiatives, the public health necessities into partisanship. And that is so sad. It's so sad, like as a healthcare professional, as a scientist, to see the work that people do and the genuine care that they have for their public be turned into Democrats versus Republicans, left versus right, etc. thing was just really heartbreaking. And that's the thing. And we're still dealing with that now, because now it's ingrained. Now it's like, if you wear a mask, you're a liberal or something like that. Or if you take this seriously and you want to close down businesses and stuff, then you're anti-business and you're anti-freedom. And it's just a lot of nonsense that really shouldn't even be given consideration. And unfortunately, like, our media ecosystem and environment kind of thrives on the clashes. And that becomes the story, whether, when they turn the story into the economy and reopening the economy and all of that kind of stuff, it just made it into an issue that was never the point of it all. The thing that we needed to do that other countries did at the very beginning in the midst of our lockdown was pay businesses to remain closed, make sure that people have the support they need to stay home. There are some places that have to be open, like grocery stores and pharmacies and such, and in making sure that there's the safety equipment necessary to keep that part of the world going. Because, we could have significantly chopped down or kept our numbers down if we had done so. And it's hindsight now. There's really no going back to fix it. And now I don't know if anybody at all really has the political courage to say, let's all stay home again for a couple weeks.
Yeah.
And I almost can't blame them, because it will become a controversy again. Nobody can pose it as a reasonable solution anymore, because it was turned into a poison pill.
It's sad. It's
Yeah.
sad, Sophia, because this is science. This is
Right.
science. And we mentioned, novel coronavirus. Novel is new. That's the definition of novel.
Right.
And when the information changes at all, because I've had a lot of people say to me and, others that, well, Fauci said this, don't wear masks, now wear masks, blah, blah. But I tell them, novel is new. And if you don't know what the definition of novel is, then I don't know what to tell you. I'm sorry. What is so wrong with people wearing masks or people actually staying home? What is wrong with that? What is so wrong with people just doing Uber Eats, and all of that, that sort of thing? Do people have to go to restaurants? Is that vacation? Is that vacation really that important?
Right.
And all? I mean, it's just a shame, and I could go on and on about this, because I think that in this kind of stuff that I have been seeing, I know you've obviously have been seeing this as well, and all, reading these reports, hearing this stuff, the fact that it has become so partisan and all that, when this stuff is science.
Yeah.
It's fucking science. On the 27th of May, you're going to hear that answer in the third and final part of our interview with Safiya Ransome. So I hope you're going to be able to join us then. And I know that there are going to be some of you who watch this that are going to quibble with Safiya's comparison of the US COVID cases to Australia. And, if you're one of those that do say that there is an issue with comparing the US to Australia or any other country, then I would say that you're an idiot. So I am going to put that argument to bed right now. So listen carefully. As Safiya correctly points out, Australia has had much lower cases and deaths from the coronavirus than the United States. Yes, Australia has a population of 25.3 million to the 328 million people that are here in the United States. But if you compare Australia to, say, Florida, a state that has a comparable population size, you'll see that Florida's sun doesn't really shine compared to the land down under. Last time I checked, Florida is still a part of the United States, unless, of course, they want to follow Texas's path in attempting to secede from the Union, except that Senator Ted Cruz was briefly kind of sort of ahead of the curve there. But seriously, though, for anybody in your life that really has this notion that the US should not be compared to other countries, and all of that, in terms of these COVID cases and everything else, then do me a favor, share this video with them, would you? And hopefully this will help disabuse them of that notion. There's a saying attributed to Bill Johnson that goes, Florida means land of flowers, not land of ugly. Well, if the COVID numbers are anything to go by, the bloom has definitely been off the rose. And thank you so much for watching. Listen, there's going to be a lot more where that came from, so you better stay tuned to catch it all. In the meantime, don't forget to follow us on all of our social media accounts for more information, including all of the bonus content that you'll see from today's show. And don't forget to subscribe and ring the bell so that you do not miss any of our episodes. And until next time, I'm Eugene Oba, and remember, we will not be silenced.